Hello everyone. Laparoscopic dye test to evaluate the patency of the fallopian tube. It is a gold standard investigation process to diagnose the tubal patency. I am Dr. Neelu Prasad, Director, Aastha Lok Hospital and Aastha IVF. Lap and dye test. It is a diagnostic procedure used to evaluate the patency of the fallopian tube and which is crucial for the fertility. And it is often performed as a part of fertility evaluation when the woman is having difficulty in conceiving. So this procedure overview here is, in the laparoscopy, we made a small incision in the abdomen and a thin flexible tube with a camera, that is the laparoscope, is inserted to visualize the reproductive organ including the uterus, fallopian tube and ovary is seen on the monitor. Sometimes some additional incision is made to introduce accessory instrument also. Now the dye is prepared. It is mostly a blue color methylene blue dye. It is an standard dye. It is introduced into the uterus through the cervix via the catheter and it is pushed into the cavity. When the tubes are patent, the dye is spilled into the pelvic cavity and that we see on the monitor. So at the time the doctor interpret about the patency of the tube and the structures of the fallopian tube and the cavity, about everything via this lap and dye test. Now I will take you into my operation theatre where this procedure is routinely done under general anesthesia for the diagnosis of the tubal patency. Now patient is under general anesthesia. We put the applicator, the grasper into the pelvic cavity and the assistant push the dye into the uterus via cervix. So this is overview of the monitor picture, and in this case the dye is just spilling into the cavity. That means the patency is normal. So both the tube are normal and the functioning. So fertility can be natural or might be due to some other reason, might be IVF and another ART procedure. So after diagnosing this patency, we just suck out the dye that is present in the pelvic cavity, and after that with the normal saline we just wash the pelvic cavity to prevent any allergic reactions and improvement. This test is a gold standard test to diagnose the patency of the tube. Although the alternative is HSG test is also a diagnostic tool to diagnose the patency of the tube. It is done as a routine procedure and dye is passed through the same procedure and X-ray is taken, and when the dye pushed into the cavity the spillage is seen and that is taken by the X-ray and diagnosis is done about the tubal patency. Thank you.